Hi, I'm Dr. Cindy Collins. I am a registered dietitian and a health psychologist working in oncology. When will you want to call the nurse during treatment? Often you may feel a little shy about asking for the nurse, or maybe you feel you're bothering them because they are very busy. That will be very clear as soon as you get there. But there are certain times when it's appropriate and really a must that you call the nurse. Be aware that when you're getting your medication, your nurse will explain to you some of the funny feelings that you might have, feeling hot or chilled, or maybe as if you're tasting something, because sometimes the medication can change your blood and then your saliva. You might get a funny taste in your mouth, or certainly if you have any sense of concern over maybe chest tightness or swallowing feels funny, always call the nurse. And I think the most important thing here is twofold. One, if you can, it's a great idea to bring somebody with you to chemo. This is one time through many that you'll like to have them there to hear what the nurse says about this is normal for you to feel, this might not be. You're going to expect to need to use the restroom as well. And because you'll be hooked up to an IV, you might feel like, oh, this isn't a good time. I have to carry the pole with me, or they'll have to disengage me. But you need to call the nurse if that's what you need. I think what's so important to know, and the other side of the twofold, is ask, ask, ask. Ask your nurse, when should I call you? What things should I be concerned about that I need to call you over? You couldn't ask that question enough. You might even ask them, is there anything you haven't told me that maybe I need to know that you just haven't told me yet? I mean, let them know that you want to make sure you're not bothering them unnecessarily, but there are times with certain physical changes that you will want to ask the nurse to come over. Don't be dismayed if you hear a lot of beeping in a chemo center. That's usually the infusion machine. It's probably fine, but sometimes it just needs to be tapped or reset or turned back on. Maybe someone has moved their arm wrong, so the IV isn't going in, as easily as it could. So you don't have to call the nurse for every bell that you hear, but for any feelings you physically have, definitely call the nurse.